toward the end of a sabbatical at the National Academy, I was introduced to some people in the Pan American Health Organization, who was the regional office for the Americas of the World Health Organization. And they were intrigued by the community toolbox, which had been going for a while by then, a few years. Loved the idea, saw it as a capacity building resource. Wanted to figure out how to connect. So we began talking. Several years later, they arranged for us to become designated as a World Health Organization Collaborating Center. This was 2004, almost 20 years ago. And that led to, again now, connecting with people who are smarter, doing bigger, better things, but particularly working in under-resourced environments. How do they figure out how to scale in a context where there are so few of them? So when we were asked to formulate, as a center, what our goals were as a WHO collaborating center, they nudged us to name our goals in things that they regarded the world needed. And I love this because it helped crystallize our center's communications about what we were about. So this is specific to the Collaborating Center, but it also informed what our Center for Community Health and Development were about. First, they said we need to expand the evidence base for how collaborative action affects change and improvement. And we need to, with respect to population level outcomes and reduction of inequities. But this notion of we need to expand the evidence base of collaborative action. This comes back to the mechanisms, the hows. How is it this works? What are the things that people are doing that enable and that impede their efforts to change the environment, the context in which people live their lives? Secondly, we've got to build capacity for this work. We have to figure out how to scale up what it is we offer so that people can be able to do this work. So it became clear in the early days when I was in Vista, back in the days doing community organizing, it's the conditions that we were experiencing in that low-income public housing project were not unique. Those conditions of oppression, the conditions of limited opportunity, the conditions that made it challenging for people to get access to the same opportunities that so many of us have had to live a full life, were not equally present for many of our friends and neighbors in that place. But it wasn't unique to that place. If that's the case, then here's where the guidance from the technological criterion comes in place. We better be clear about how to do this work, clear enough that people will never meet in places we'll never be, can do this work a little more effectively because of the privilege we've had to be at this work over time.